What's up, everybody? Thanks for joining our Doc Talk today. This is our Thanksgiving edition right here before the holidays. We're so glad you can attend. Guys, and before we get started, I want to remind you, Altus is doing a food drive. So bring all of your non-perishable items to any of your Altus locations, whatever is closest to you. We're trying to give back as much as we can, and we need help. We need to collect as much food possible so we can get back to the community for those in need. So we'll be doing that all the way up till November 22nd. So be sure to drop any of your items you have, anything you don't need, any non-perishable items. Like I said, check our Altus pages for more information. We have a list of different items that they could use. But anyway, thank you guys so much for joining today, our Doc Talk. We're going to be talking about RSV and flu. Let me see if Dr. Goffey is ready. Dr. Goffey, how are you, man?
Hey, I'm good. How are you?
Good. Go ahead and tell you Happy Thanksgiving. This is our Happy Thanksgiving edition of Doc Talk.
That's right. And I'll be joining everybody in Lumberton. I'll be working Thanksgiving.
That's right. Hey, check out your new haircut. He got all cleaned up. New look today.
I couldn't remember if it was mustache November or whatever it was.
Or no shave. Who knows, right?
We had a wedding. And I was like, you know what? It's my wife and I. It's been a while since we went out without the kids. I was like, let's do something different.
Right, for sure. So, I don't know if you know, but Lumberton, talking about you working in Lumberton shut down, I guess, last week, 2 days. Did you hear about that? They said they had an outbreak of RSV, flu, and maybe even some of that, is it adenovirus?
Adenovirus. Yeah. I mean, we've been staying real busy, especially, late at night, kids, with fevers and stuff, and just not breaking or kind of responding, but lasting, a significant amount of time, right? And I think that's a nice gateway to talk about the closure, right? Like, why is it happening? And remember, we've been talking a lot about COVID, but all COVID did was really do a good job of us avoiding, even though we got COVID, we weren't getting, the 24-hour bug, right? That we used to get, right? We weren't getting as much strep. We barely talked about flu. I mean, flu up until this year, probably like 6 cases I dealt with. It was very little.
Right.
So of course those viruses come back with a vengeance, right? Like they need, in order to survive, they get more virulent. They get more powerful. I think the biggest thing that we all have to remember is the adenovirus, which is really the most common virus, and unfortunately we can't test for it. Don't get frustrated if you go somewhere, you're sick, and it's like, oh, it's not COVID, it's not flu. It's like, well, That's the way it used to be as well, right? We just lost our immunity. We don't have immunity for flu and for adeno after a year or two of not getting it, right?
Yeah. A lot of people wondered where the flu went. Everybody's like, where'd it go?
And the adenovirus is funny because most of the people are coming in 5 days, 6 days, not feeling well. And, realistically, the adenovirus became that 24-hour bug, right? The adenovirus caused everything head to toe. The pink eye, it causes cough, congestion, sore throat, nausea, vomiting. This round, it's causing a lot of nausea and vomiting. 3 days, 4 days, 5 days. So when I studied this virus in medical school, it was a 4 to 7 day virus, right?
Right.
But we got it once or twice a year because our kids got it 2-3 times a year. So we would get it as well at home. And, you'd feel terrible for a day. Next day you're able to go back to work, right? So, it wasn't over in 24 hours, but you felt fine to go to work. And now it's 3, 4, 5 days, and the nausea and vomiting is terrible. The diarrhea is terrible. So, it's not the death-causing COVID cases that we had with Delta by any stretch, but you're not feeling well. I'm definitely seeing a lot of people, in the emergency room for it.
Right. So how concerning is this year's outbreak, I guess, of flu and RSV? Is it real concerning, or what do you think?
I would doubt that it's any different. I just think people are I think we're just treating these little epicenters differently, right? Who wasn't sick in the beginning of winter, before COVID, right? I don't think the numbers are much higher. I just think people are tallying them and they're just seeing what's different. I personally just really believe in herd immunity. So I don't think school closure is necessarily a good thing. And I know the downfall associated with it, right? It's hard to keep your kids at home most of us are all dual working families.
Yeah, even the teachers, were out, so it was hard to run the place, I guess.
Right. Well, exactly, and that's tough on everybody. It's really tough on people, and I had a patient. The kid wasn't feeling well, and they didn't have a fever, but they still weren't feeling well, and they asked me the question when to go back to school, and it's like, I mean, you have no fever. You're going to be the only parent that would hold their kid back from going to school without a fever.
Right.
It's hard. I mean, if you can do it, I mean, kids feel better at home, but missing school is not positive either, right?
Right. So what age is RSV common to? I think I hear a lot that it's for younger kids. When you say younger kids, what is that cutoff age? Usually you see RSV stopping at?
The most susceptible kids are, still developing, right? A year, 2 years, 3 years, or of course, anybody with asthma, like pulmonary issues. But RSV can hit adults, just normally we don't feel it, right?
Right.
It's not that bad.
We bounce back a lot better.
But it's very common for RSV to cause what's called a viral pneumonia. No antibiotics do anything for it, but it could increase. One of the things associated with it is fatigue for kids. Sorry, because you'll notice them, really breathing, and it's not wheezy, right? Like asthma. But they get tired. They get really tired. So they get fussy. They don't eat, and then the fever tacked on. It just doesn't feel good.
Yeah. So how do people catch flu and RSV? What's the number one transmission? How do they get this? Is it from touch? Is it from the
coughing? I mean, kids, RSV is kids, right? Your kid hangs out with other kids. I mean, God.
Yeah,
filthy animals.
Gonna go spread really quick through a school,
Yeah, exactly. I mean, imagine 0 to 3 if your kid's in daycare. I mean, how bunched up they are, right?
Every week it seems like somebody's sick at daycare. I mean, daycare.
Yeah, exactly. I mean, it's daycares are not known for not being able to spread, these viruses. But at the same time, flu. I mean, the cases that we're seeing really, it's not. I mean, a family's going to get it, right? A family's going to get the adenovirus. A family's going to get the flu. The kid is going to get RSV, and kind of bring it home. In your home, it's impossible to stop it. I mean, it's really out and about. It's not nearly as contagious as COVID, but we are going out into the world again, right? I mean, and it's really the cold season. You're coughing more, right? It's not as hot, so the virus doesn't die as fast. Like in the summer, you cough, and kind of before it gets to like 5 feet, it's dead. But in the winter, it could go a minute, 2 minutes, 3 minutes, right? So things at the grocery store, if you touch every tomato right after 3 other people, that can happen. Railings, things like that. But keep your hands clean, keep them away from mucous membranes.
And keep people out of your face, huh?
Keep it out of your face, and then that helps a lot. That helps a lot.
So, hey, curious, I've got a question. So does taking vitamin D or any of these vitamins, vitamin C, vitamin D3 with zinc, does any of those really help boost your immune system? What do you think about all those?
Yeah, I mean, I think all vitamins are great. I mean, nobody can say a vitamin is not positive. They're not cheap, I personally think the best vitamin, the best multivitamin, the best thing that you can take, it's not easy to take, but the best one for both men and women, believe it or not, is the prenatal vitamin. It's phenomenal. It's got everything you need. It really is. It's the most fantastic vitamin you could take. The problem is it causes constipation because it's got that folic acid.
Mm-hmm.
But I mean, if you can get around that, like take it every other day, there's not a better vitamin on the planet. I mean, that's the most compiled. I mean, it's making a baby. There's nothing better. You'll see it in your nails and your skin and everything. I mean, it's an incredible vitamin. It is hard for a lot of people to take consecutively.
Yeah, I've been trying to take every day. I mean, I miss some days, but I've been trying to take the vitamin D3 with the zinc. So far, I've been taking that. So hopefully that will help build my immune system up a little bit.
Yeah, I mean, vitamin C is very good. It's just most of the time, if you're sick and you start taking them, it's helping. It's just, you're sick. So your body's running through it.
Right. So if any of the kiddos or family members, get flu or RSV, is there anything they can do? At Alta, should they come to the ER for treatment, or when should they come?
Well, I mean, you really want to be careful. Most of us don't have those pulse oximeters. They don't have both pulse oximeters for at home to like monitor it. I mean, a baby can be fussy and sleepy, but if you got to be careful. They might need oxygen, right? I mean, you want to make sure that that's okay. With the flu, to be honest, Tamiflu is out there. I don't mind writing it, but Tamiflu, like Paxlovid, it takes away a little bit of what you build for immune response. And it's been so long since we've really had flu that, if you can manage without taking the Tamiflu, it would be better, right? And also, it only is effective if really taken, they say 48 hours, but it's really 24 to 30 hours. That's
so you have a short window to get
right. I mean, so if you start feeling something, if you want it, you really come in immediately, right? Because its effectiveness is really a lot lower. Really, with the adenovirus, the nausea and the vomiting, I can't stress enough how much IV fluids goes a long, 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 long way. People feel dramatically different, recover much better. I mean, it has been really bad. I mean, people are vomiting 10 to 15 times a day for a day, 2 days, 3 days. It's very, very.
Yeah, I saw a Facebook review talking about you actually a few days ago. You gave somebody IV fluids and they were just talking about what a tremendous difference it made. They were so happy you gave it. Man, even if you don't have any flu or RSV, IV fluid.
And don't get frustrated by testing negative for those things. It's probably the adenovirus. We can't test for it, but it doesn't mean that the symptom control is not nearly as effective. I mean, at the end of the day, guys, we talked about Regeneron with Delta, but even with COVID, I haven't really pushed a lot of treatments for that stuff because you kind of want the immunity. It's been mild enough that we can get through it with symptom control.
And fluids, man, that really makes you feel 100% better.
I mean, you don't understand. You throw a fever, and you're like, oh, I had some sweats, and you don't realize that you soaked the bed, right? I mean, so imagine spilling a cup of water. It doesn't wet the bed nearly as much as what you did just sweating. You lose liters of fluid, liters of water. Even water drinkers are coming in with constipation after abdominal pain. Because if you don't have enough fluids in your body, it takes it from the large intestine. So hard stools, abdominal pain, more nausea, more vomiting because you're just dehydrated.
Right. Obi just said both of my kids were sick for 48 hours and then they were fine. They were positive. They weren't positive, I guess, for flu or RSV, but I'm sure they had one of them.
Yeah, I mean, and that's a pretty typical thing. I mean, maybe it was that you just caught it at the tail, right? I mean, you're not testing positive for a week, right?
And have you ever tried to hold Have you ever tried to hold a little kid down for a test? That's pretty hard to get a good test for the kid. They're fighting the whole room of nurses. So Katie just said, are you seeing an increase in ear infections secondary to the flu this season?
So not so much ear infections, but strep throat, I will say, is becoming very positive. And remember, strep lives in all of us, right? Every single human has strep in their mouth, okay? So what's happening is 3 days, 4 days, 5 days of that or drip, right? You create little micro breaks in your throat, right? And then the strep can seed in. It's not common for adults to get strep that often, right? I mean, it's mostly for kids. But we're diagnosing more and more strep in adults day 4, 5, 6, 7. So a lot of people, they got a little bit better, but they had a cough for a while, and then they're coming in, they're like, wow, my throat is terrible. And they're ending up testing positive for strep. And it wasn't strep from the beginning. You know what I mean? It's us kind of causing that trauma to the throat area. And then that it's just seeding into those little micro areas where, where you were kind of bleeding, not bleeding, right? But you don't notice it because it's in the back of your throat.
Right. So for the people that are watching, is it too late to get the flu vaccine? Because a lot of people are getting it. Is it too late right now to go get it, or what do you think?
I get the flu vaccine every year. I usually get it because it's mandated for us to get it.
Right.
I probably am one that doesn't always need it because I always contract flu no matter what every year. I always get it. So if you are positive for the flu, then same as COVID, right? There's nothing better immunity than getting it. But if you haven't had them, and definitely you're in the risk factor groups, it's going to be a strong year. So I think anybody with asthma, COPD, above 55, right, you should definitely get the flu vaccine.
Right.
We won't know how effective the flu vaccine would have been until probably February. But
Right.
I mean, if you're in a risk factor case, I would highly recommend it. Yes.
Okay, so if you're watching, guys, you heard it. You need to get the flu vaccine if you haven't. There's still time. Let's see. Have you? And out of curiosity, I saw somebody ask, have you seen the flu and COVID together? Has anybody this year so far had both at the same time?
Yeah, I've had the trifecta: flu, COVID, and strep on a few
Oh my
days.
gosh! How extra miserable.
When it rains, it pours on some people. Yeah, I mean it can happen. We used to see a lot of strep and COVID, but for the same reason, right? Because you're testing positive
Secondary.
for and then you kind of develop it. People coming in day 5, 6, 7 later on, and not day 1, but later on, people were positive for both. But I mean, right now, 'tis the season. I mean, wow, did it drop? Mother, wow. I mean, I left to Georgia and it was 85 degrees. I came back, it was 38, 42 the next morning when I left work.
Yeah.
So, and remember the cold, guys. I think it's also very important. So, one of the things to remember about the cold, it's not that you're out in the cold and it doesn't matter how warm you are. It's what you're breathing, right? So you can be as bundled up and warm as you want. It's the cold air touching your lungs, right? That's what causes, I wouldn't call it trauma to area, but those smooth muscles to constrict and then cause these issues, right? So it's about warming up the air, a scarf, things like that. And also avoid, I mean, what time is it getting dark now? I mean, it feels pretty early.
It seems like 5 o'clock.
5:30, right? So if you notice, up until it's about to get dark, we do like a 25, 30 degree drop, guys. It's pretty serious, right? I mean, if you pay attention to the thermometer, that's the time that you're most vulnerable, is that time exactly. Because you're going outside, you might be warm, but you just breathe in 20, 30 degree shot of 35 degree, 40 degree air.
So my wife, my mom, my sister, all of them always tell me, don't let the kids go out, in the night air because it can make them sick. So are you telling me if they breathe that night cold air in, that can make their symptoms worse or help them get a cold?
I mean, if you're susceptible to it, absolutely. I mean, and it's about that rapid drop, right? I mean, is it going to affect a 9-year-old the same way a 65-year-old smoker? No, absolutely not. But that can, if you're already weak for something else, or that could make the virus worse, right? If you don't breathe in a virus, you're not going to get a virus, okay? So if you're outside, that's not what's going to happen. So if you're a young, healthy lung, it could just make you cough, it could make you feel that stuff. But you just got to be careful during those times, because the recovery will be slowed down because you just keep kind of aggravating the lung tissue.
Right, for sure. And I know this may sound silly to some of you guys, but I actually get this question a lot. So I wrote it down for this Doc Talk. A lot of people ask me, if you get the flu vaccine, does it help protect against COVID at all? Does it do anything?
No, it does not do anything. Flu is for flu. The flu vaccine is actually a pretty extravagant vaccine. It's not, it's not like we had a strain of like we did when we started with COVID that was like a strain or two. The flu vaccine is a polymix of hundreds of old flus and hypothetical new flus. Significantly more effective on flu B, right? The difference between flu A and flu B is they're both treated with Tamiflu with his oseltamivir. I was butcher that one, but it's effective for both. But B can just, if you think of it like a log drifting through like a river, right? But A can basically leave that river and jump off into another river, because it can cause an actual, change and cause these global pandemics. A. B will never do that. It just slightly mutates, right? So the vaccine is significantly more effective on B than it is on A, because A can change completely, right? I mean, you can have an H1N1, for instance. Everybody remembers that one, right? So those are the major differences between them: a shift and a drift, right? Yeah. So you can shift the entire virus in a new direction with A, and you just drift with the B. So the vaccines are obviously more effective with B. And yes, I'm seeing more A this time around, because naturally we had to. There was no flu for the most part last year, so it had to mutate.
Right. So you're speaking on flu. I'm glad you brought this up. You're speaking on flu A versus flu B. So when patients come in and they want to get tested, can you tell them which one they have? Does it say A or B?
Yeah, we test flu A and B. Yeah,
Wow,
we'll
okay.
tell you exactly what it is.
So you'll know 100%.
Yeah.
Okay. And you said you see more flu A right now?
Yeah, this year, I think I've only seen one B case.
Wow. So Lori just asked, what are some signs, some symptoms to watch out for that would indicate these common seasonal sicknesses are more severe and you should consider an ER visit and not just think it needs to run its course? So yeah, so she's asking, when do we need to go to the ER rather than let it, run its
So,
course?
I mean, the biggest thing is if you remember, the key to all of these things is fever control and avoiding dehydration. If you're someone who's diabetic, if you're someone who's hypertensive, dehydration is murdersome. I mean, your medications can cause renal failure. Your medications can cause a lot of problems, and that's the problem with being dehydrated and getting a virus, right? It's those other things that you have well controlled become uncontrolled. So it's never too early, right? If you don't feel well, and I don't mean like I have sniffles, like if you feel body aches, back pain, that could be coming from your kidneys. You need to be careful, especially if you're on insulin or you're on metformin and you have, these comorbidities, as we call them. You need to be careful. You do. I mean, and that's why most of the people, when you say, hey, you give a liter of fluids to somebody and they're a different person, well, of course. I mean, all of those medications, the most common medication for blood pressure, believe it or not, is a diuretic. If you have a fever and you're dehydrated and you're making yourself pee more, you're not helping your cause. You're lowering your blood pressure, but you're not helping your kidneys. You're not helping your body. So there's side effects. When you read the label of medications, it's not usually on a normal day. It's things with viruses or these other things happening in your life that cause those side effects.
Right. And just out of curiosity, what fever bothers you? Like, I know, as parents, we're like, oh, it's this or that. What fever would you say is a fever wise, if you're looking at just that to bring your kids in?
I mean, listen, a fever of 103, 104, most of the time is not real. I mean, it's real, like it's a fever, but it's really dependent on where you take it, right? I mean, most of us are not pulling out rectal thermometers for kids.
Yeah,
right?
the kids don't like
those fancy ones, and they could be a little bit higher. I guess the better way to answer your question is not necessarily the number. I would tell you it's one that does not respond to Tylenol or Motrin.
Right.
If it's not responding to Tylenol or Motrin, like at all, it's 103 and stays at 103, or 102 and stays at 102, that's a fever I would worry about.
Right. And don't you, as a doctor, don't you recommend if the child is not drinking or eating, that's another red flag?
Exactly.
Right?
Exactly. So listen, if kids are having wet diapers, kids are eating and drinking, and their fever is responding to Tylenol, you're in good shape.
Mm-hmm.
Now, come in for a screening. I'm happy to see you. That's what we're there for. So we're there for the community. Right. If you're just concerned, but that's going to be my reassurance, right? I mean, so unfortunately, these fevers can take 3, 4, or 5 days. But as long as it's responding, it's good, and I will not be offended that you did 2 doses of Tylenol and Motrin and it wasn't responding and you get to me and it responded. Don't feel bad. The car never makes a noise when it goes to the mechanic.
Right. That's very true. Very
okay.
Good analogy. So Carrie just asked, how many days does it take for RSV to peak and start trending down? I have always been told 7 days.
So if you get the pneumonia, like from the RSV, which is quite common, that's about right. Yeah, 7 days. Yeah, that's kind of coming down. But if you get the viral pneumonia for RSV, and let's say you're 1 week in, and I see it on X-ray, I'll probably see it for 3 or 4 weeks, but the kid will be fine. It takes about 4 to 6 weeks for you to the X-ray to be kind of clear, and that's on everything. That's pneumonia, viral pneumonia, bacterial pneumonia, all of them. It takes a significant amount of time for you to see, imaging changes on the lungs.
Right. And speaking of pneumonia, somebody just asked, what is walking pneumonia? So we hear that sometimes. What's walking pneumonia?
So, and excuse the name is going to get a bad, projection, but walking pneumonia is actually chlamydia pneumonia. That does not mean that you have an STD, chlamydia.
Right.
It means chlamydia pneumoniae is another form of pneumonia, and it's called walking pneumonia. Mm-hmm. And those we treat with, we used to treat with a Z-Pack, which I'm kind of waiting. There's supposed to be a new guideline just because so many people have taken the Z-Pack. We don't know if it's going to be effective,
right.
As effective this year or next year, right? I mean, the Z-Pack basically became vitamin C for a lot of reasons, right? When we started treating the COVID. So we don't know its effectiveness, but walking pneumonia means your lungs are almost white out like a COVID lung, but it's not as deep. It's more superficial. So you look like you have this terrible pneumonia and it's caused by chlamydia pneumoniae. And but you're walking, you're talking, and you're feeling okay. You just have this cough, basically.
Is it still serious? I mean, can it escalate or get worse?
I mean, it's for the most part, it's not. I mean, it's a cough for weeks, and it's not nearly like COVID. I mean, if you saw that lung in COVID, you were very concerned. You see that lung with walking pneumonia, it was a common thing. Most people are, they're not hypoxic. They're not, they're okay. It's just the lung looks bad.
Right.
They usually come in for a cough of 2 weeks.
And I heard you talking about Z-Pak and how we were taking it so often, so frequent. Just curious, after years pass, do you get that, does it start working again, or do you lose it, I guess its effectiveness on a person if they take it too much? Does it ever work again?
Yeah, so I we run into resistance by area. I think urinary tract infections, for instance, are the best example of that for women. There's a time that everybody got Bactrim, for 3 years. And then all of a sudden they became resistant, and then everybody went to Macrobid, nitrofurantoin, and everybody was on that. And it starts to fail because that was, kind of what we read that we should prescribe. And over time it develops. A lot of you guys may not remember doxycycline, right?
I remember that one. Yeah.
That medication almost got black flagged, in 2007, 2008, 2009. Because we used it all the time. And it was really for MRSA, right? Staph infections, pneumonias, skin infections. So we stopped using it and we started using clindamycin, we started using Augmentin. And then, clindamycin became a little bit resistant, right? And then we, brought on these other medications, right? Just like for the past 5 years, Levaquin, right? Levaquin was...
Man, I forgot about that one. I don't hear about it.
Day,
I don't hear it.
Magic pill. So all antibiotics have a cycle, and eventually, you're going to fail. And once you fail, you switch it up. And the other one, that old wonder drug that became not wondrous now is wonder drug again.
Now that you mentioned Levaquin, I remember that seemed like that was all the time. Levaquin.
Yeah, I mean, the success of Levaquin was the fact that it was once a day. I mean, how many people forget to take it twice a day, let alone clindamycin 3 times a day?
Right. So this is probably kind of goes hand in hand with what we talked about earlier, but what causes people to die from flu? It seems like, you hear a lot about deaths from flu, but it seems like we don't hear about it as much now. Is it because it goes untreated?
I think we're going to start hearing about it now, but it was 50 to 70,000 cases a year, of deaths, right? I mean, it wasn't COVID numbers, but it's a lot. I mean, it's a lot. It was never a young, healthy kid. It was never a healthy 25-year-old. That was the difference between COVID. But, all of those factors, if you have heart failure and then that speeds up your heart and puts you in heart failure, if you have diabetes and then it puts you in diabetic ketoacidosis, those are things. You're not eating, you're not drinking, you're still taking the same meds, you're trying to be productive, you're nauseous, you're vomiting, all of those things, waiting too long to get to a center to kind of replenish you. That can lead to that. But it's usually not the flu that killed you, it's the downwind that
right. Okay. So like we said, this is Thanksgiving. We're about to have Thanksgiving next week, and I know this is not related to flu or RSV, but recently I went to the doctor and my triglycerides was super high, really high. So since we're about to start eating lots of good foods, I'm curious, what causes these triglycerides to go up? Is it the fatty foods I'm eating? Is it the sugar, or a little bit of everything?
Between fatty foods and sugar is both of those for sure. The biggest thing is once you get to a certain age, it doesn't matter what you do sometimes, right? I mean, once you pass 35, if you're susceptible to having high cholesterol, you can do the diet, you can do anything you want. It's just that's what's there. Be careful when you do your lipid panel. We tell you to fast for a reason. If triglycerides, if you literally have coffee with cream, they could skyrocket before you do the test.
It was still a little bit high, but after I fasted and went back, it was a little bit lower, but it was still elevated. But it was a big difference,
Yeah, but it is. So you got to be careful. If you're going to do a lipid panel, you really do have to be fasting, because you eat a bite of your little girl's, breakfast sandwich, it's going to go up. Okay. Yeah. But in general, life is about balance. I love chicken wings. I just love them. Okay.
I see you
eating
them a lot.
without eating chicken wings. So life's about balance. It's about eating correctly. It's about eating at the right times. It's about diet and exercise in that sense, but it's also about what you can live with consistently, right? And if you live a consistent life, you're healthy, you try to do as best as you can. You might need a medication. I mean, I'm on Crestor and I run triathlons. It just doesn't matter what I do. I eat good, I do everything, but I have high cholesterol in the family. There's nothing I can do. I've been on it for years.
Yeah, so I've always thought, I'm skinny, I'm healthy, but that's not always the case. I'm 37 now, like you said. So even though I'm skinny, my level, I was really shocked that they were elevated because I feel great. Yeah. But it'll trick you.
Well, it's like blood pressure, right? You don't feel high cholesterol and you don't feel blood pressure for the most part. I mean, and that's why they're called silent killers, even diabetes. For the most part, most people are, randomly diagnosed, not because it's like, oh, I have this headache or I have this. I mean, they're underdiagnosed for that reason.
Right. Well, Doc, before we let you go, Thanksgiving, the holidays are coming up. Let everybody know that we're here, that we have free medical screening. If they need you, you'll be working. So
I'll be there Thanksgiving, everybody. Absolutely, guys. I can't stress enough. These flus are coming on strong. It's the first day of sniffles I can understand, but if you start to feel those nausea, vomiting, back pain, that's what we're there for. Free medical screenings are there. We're there to take care of you, the community, and that's why we go to work every day. And so please, make sure you come in.
Chris loves your stash that you got.
I like it. My wife likes it.
I don't know. It's kind of giving me Captain Hook vibes,
I know.
Pirates of the Caribbean here. Hey, real quick before you leave.
It's like I guess a little dumb dad joke. What's a pirate's favorite letter?
R.
You think it's the R, but it's
I'm a dad. I know it. All right. Sarah said, can you explain to parents what they can do at home for comfort measures when their kids are ill with the flu or RSV? So how can we clear this mucus in kids?
Actually, you know what? We didn't talk about that. Nice question. So let's talk about Tylenol and Motrin. Okay. Tylenol, acetaminophen, you filter it through the kidney. Through the liver. Okay. It goes through the liver, right? Versus Motrin, ibuprofen, that goes through the kidneys. All right. So when can we take them? All right. We can technically take Tylenol and Motrin at exactly the same time because you filter them differently. Okay. So this is very important. You can take each one of them every 4 hours, which means, let's say a start time of your day is 8:00 in the morning. Tylenol works way better for fever. I mean, there's nothing better to lower a fever than Tylenol. But kids are different humans when you give them Motrin. Right. I don't know what it is. You give them Motrin, it's not as effective as it is for the fever. It does lower the fever, but it's not as effective as Tylenol. But if you start Tylenol because they have a fever at 8 in the morning, right? And you want to, and it's day 1 or day 2, and you know that this fever is going to come right back. At 10 a.m., you can give them Motrin. And then at noon, you can give them Tylenol. And then at 2, you can give them Motrin, right? And if you have a kid that is really not feeling well, and it's the first or second day, you want to do that, especially because a child will not eat and drink with a fever. So even if they don't have a fever, and let's say it's 11 and you're going to go eat at noon, give them Tylenol or Motrin. Give it to them. That way in an hour, they're going to feel great. They're going to feel fine. And they're going to eat. They're going to drink. Does that make sense? Instead of them feeling terrible and it reminds you, oh my God, you have to drink water.
Right.
You're going to want to drink it then. They feel terrible.
And you notice as soon as you give them that, then they may be laying around lethargic and they're bouncing up. They're feeling great again.
Oh, yeah, it's like, exactly. You give a kid, you give a kid Motrin. I don't know what happens. All of a sudden they put their shoes on and want to go play outside.
Yeah.
They feel great. Parents, what they can do at home for comfort measures when kids are ill with flu and RSV.
So what about?
So for starters, I was mentioning the Tylenol and the Motrin. That helps dramatically. There is something that kind of looks gross, but the nose Frida. I don't know if you've ever. You can order it on Amazon. I find that ordering on Amazon is faster than trying to get to the store. So you can order it, and it's like a bowl. that you put in here, and then you actually suck it out, especially with young kids, because young kids are not going to be able to blow their nose. Okay. The other thing that you can do, probably stock up on that because it's getting there. Those misters, just to kind of put some humidity in the house. Those help dramatically. They're a lot easier than for a young kid, I think, than Vicks. I mean, Vicks works, but they start to touch themselves and all of a sudden there's a mess everywhere. You want to keep it pretty close to them. My father, you look in and it looks like you're walking into a tropical rainforest. He's got like 5 of them in his rooms, but every single time he goes in the cold. But 1 or 2 for a decent sized room. So they actually make Tylenol. That's another good question. They actually make Tylenol suppositories. And if all said and done, you may need that.
Right. I didn't even know that. I didn't even know they made those. Wow.
They make suppositories for Tylenol and for Motrin.
Wow.
So essentially, if they are throwing up, if they're actively throwing up, guys, and you have the suppositories, don't try oral first. Do the suppository, right? Because you don't know if they swallowed some or spit it all up. Tylenol is a little bit more forgiving because technically all the dosing that you have in the bottles is off 10 milligrams per kilogram, but you could give up to 15 milligrams per kilogram. So if they do spit up Tylenol and you put the suppository, that's fine. Okay. That's okay. But Motrin is not, you probably want to avoid that one. So if you give them Tylenol and they spit up the Tylenol, I would put a Motrin suppository.
Right. And if that doesn't work, I guess you could give it, if they come to the ER, you can help them with the IV, right? You can give them Zofran.
Yeah, we can help them. I mean, we can help them with that. I mean, you want to be careful. And sometimes you have to. I mean, there's some kids, that's why I ask, sometimes people are real short of breath. And, a steroid, if you give it oral or you do the shot or even IV, it's equally as effective. But if a kid is throwing up, I want to get the steroid in. Your kid more than I do. If they're not good with medicines, that's why usually we give the shot. Mm-hmm. It's not that it's better than the drink. It's just I can guarantee you're going to get it, right?
Right.
And that's really the biggest thing. Some of these meds, you want to guarantee they get them, right? Because of the nausea and the vomiting.
So if a kid took a Zofran by mouth, let's say, but they throw it up right afterwards, can you give them another one? Or are you afraid they've already,
I mean, if you see the pill, you're good. I mean, but if it's kind of chunky,
it makes you wait
an hour or 2 and then try again.
Okay.
Yeah. And they have suppositories for that as well. I mean, they have suppositories for everything, guys.
I didn't know.
I'm not telling everybody to go get suppositories.
My kids, they would beat me, but that's good to know.
I mean, just mostly for infants, not I don't think my 12 or 13 or 14-year-old's going to accept that, but but they do make them. They do make them. And again, if we're talking like you put it in and they spit it out, give it again. Right. But if they threw up, 3 minutes later, that's been in their stomach.
It makes you worried that they've, I guess, taken their bloodstream already.
They absorb something. Yeah, right. Sure. That stuff is absorbed pretty quick.
Yeah. Well, Doc, thanks again, guys. I appreciate y'all watching. And like I said, Doc will be here Thanksgiving. If y'all get sick, come in. We got that free medical screening. Dr. Goffey will take care of you. So,
take care, everybody.
Hey, thanks, Dr. Goffey.
See ya.
Guys, thanks for tuning in. We appreciate it. We love our community. Again, happy Thanksgiving. We hope you guys have a blessed one next week. And if you didn't hear at the beginning of this message, our Doc Talk, we're going to be doing a food drive all the way up until November 22nd of this month at all of our Altus locations. So if you have any non-perishable foods, please drop it off. Bring some food by. There's so many families out there that we want to bless and make a difference in, and we need your help to do it. I don't want anybody to not have a Thanksgiving meal with their family. It's so important to be with your family at the table and celebrate this year and all the good things that have happened. And it's been rough for a lot of people. Not everybody would probably say they've had an amazing year because it's just been tough. And we want to give them something good that they can enjoy and relax and have a good time with family or friends. Guys, again, thank you so much for tuning in. Remember, we're here 24/7 for all emergencies. We'll be here Thanksgiving break. If you eat too much turkey, we're here. We got Dr. Goffey, and we got all kinds of good stuff for you. So we have that free medical screening. If you need peace of mind, just come on by, guys. We'll give you that VIP treatment here and get you feeling well, get you home, get you better. But guys, happy Thanksgiving. I'll see you next month. This is it for November. Thank you so much. If you have any comments, any suggestions, please comment below. I'd love to hear from you guys, and we can make a topic about what you want to hear about, what you want to talk about. So guys, we'll see you soon. Be careful. And this is Reagan signing off. I'll see y'all next time on Doc Talk.